All right, as it is 7 o'clock, we will start this special meeting of the Rhode Island Olivia Lake Lillian Independent School District number 2534 special meeting. We'll call this to order. We will begin with the approval of our agenda. Motion is made by Bookdill. I will second it. Are there any questions or discussion about the agenda at all? All right, hearing nothing, we will vote and we'll begin with Jeff.
Aye.
Sandy? Sandy was on here. She's on mute. I'll ask her to unmute. We'll move on to Tracy.
Aye.
John?
Aye.
Melissa?
Aye.
Sandy?
Aye.
And I don't believe Jamie is on yet. So with that, motion carries. Moving on to new business. Number 1, information on back to school, review and discuss MDE and Governor Walz's plan options. And I will turn that over to Mr. Brandzoy.
Good evening. Last Thursday, July 30th, the governor came out with his recommendation for the Safe Learning Plan, and he's been working very closely with the State Department of Education and also the Department of Health. And he's had quite a group working on this document, and so we've been waiting for it patiently, and so we have it now, and I sent it out to you so you can look at it. And I'd like to just go through it. We'll go through it rather quickly in the sense that if you have questions, either stop me or we can come back and ask questions later at the end also. But it's a lot of information, and I wanted you to have the opportunity to read through it first, and then we would take a look at it. So, but first note that what the Safe Learning Plan goals are, and I think this is very important that we keep the focus and prioritize the safety of students and staff is number 1. And then prioritize in-person learning, especially for younger learners, is the second goal. As a district, we've talked about that. 3 is consider infectiousness and transmission risks among different ages and support planning while permitting flexibility for districts. Number 4 and 5 is to take into account disease prevalence at a local level. And so I think 4 or 5 very important goals that they focused on in developing this plan. And so you can go through it as you have time, but we'll just quickly go through it as a team here of the board and myself. The letter from the governor, I think I'd like to take some time and read that. I think he said it has a lot of good things he's saying in there about students and school and staff and families, and focusing on them, and his background in education gives him some real insight into what it is in the classroom and working with students and families. So I think we're very fortunate to have a governor with that type of a background, and so he cares a lot about students, about kids, and families. He's got a high schooler himself, and plus he had one, I think, that graduated a year or 2 ago. So he's got young members of his family that are very involved with education, and his wife is also involved. And if you go with his staff, the Department of Education has a very strong background also in education. They're educators, teachers that have come out of the teaching field to help out with the State Department. So, but I think we're fortunate we've got him to help us get through this crisis, this pandemic. So the overview on page 4 is just looking at what it's based on, and really it's his executive order. The last one here was adhere to parameters determined by health department in implementing or shifting between the 3 learning models laid out in the in the school year learning planning guideline, and he covers those in this information. So the parameters are detailed in the safe learning model guidance, which you're looking at right now, and looking at using a more restrictive learning model, and so as required by the model that we'll look at here. And so they talk about a regional support team, and that's one thing I think he has really shown is he's bringing in a lot of resources. The health department, the state department, the university, research, Mayo, all these people have been engaged in putting this plan together. So then in the middle of page 4 there, you got the public health guidelines, and you can review those as a focus with our working with the public health department. So, and then the safe learning model guidance. And so this is where we'll start in determining the safe learning model at the start of the school year. And that's what he is focusing on right now, and we're focusing on it. We've been talking the month of June and July, been looking at where do we go this fall, and so we've been waiting for this. We've been pretty much just the staff meeting. Today we had our third all staff meeting, but we've been meeting administratively and looking at the different plans and the 3 scenarios that we've got out there. And so now he puts a plan determining a safe learning model at the start of the school year. And so he goes through the 5 steps there and recommending, and first of all is the Department of Health uses the data for the counties to determine the base learning model for public schools. And the second step then is MDE will share the county data and the consultation process for public schools to engage. Then the step 3 is kind of where we're at right now, is and forming an advisory council. He calls it an incident command team. We're calling it an advisory council. Evaluate their ability to implement the required and recommended health best practices. So that's probably where we're at right now in discussing this, and now we're ready to move to that. And they have a meeting scheduled tomorrow. We selected an advisory council, and then they'll come back with their support and what we're looking at and recommendations. And so then the step 4 is with the public health, determining a learning model to begin the school year. And that's where we're headed. And I think we've got a plan now that we're looking at, and I'll address it later. So step 5 is then the school and the Department of Health will monitor the community and the school level impact of COVID-19 on a regular basis. And you'll see the number 1 there is a model that the Department of Health is going to use. And so it has to do with the 14-day average of county residents, a biweekly case rate, and that's what they will put together and put out to the counties, to the school districts who will come from the counties and give us that figure. So, and then the next slide says learning model parameters. And so that's what we can look at, is saying the number of cases per 10,000 over the 14 days or county of residence. 0 to 9 is in-person learning for all students. And if it's from 10 to 19, well, then you can in-person learning for elementary students, hybrid learning for secondary. 20 to 29 cases of hybrid learning for all students, and 30 to 49 goes hybrid learning for elementary, and it's distant learning for secondary students, and then 50 plus the distance learning for all students. So this number will be every Thursday. We'll get a review of this, of looking at it, and we'll get that figure from the county. Right now, of our last 14-day period, which ended July 18th, was at 4.76, was what Renville County was. So we would qualify then if the staff and administration and the board decided to move forward that number, and we could go to an in-person learning for all students. And so with that information and getting that last weekend last Thursday from the State Department, and then talking with the administrative team on Monday, and then coming with our all staff meeting and our supervisor meeting today. At this point, this is what we are looking at and trying to set up and going to recommend for both schools at this time. So, but this is a starting point, and the governor and the commissioner really emphasize that this is just one. And so we have to look at all the goals that we're trying to set up. So, so I think it's combining the understanding of distance learning is more difficult with younger learners and creates a more significant burden on families, encouraging districts to always consider ways to keep elementary students in person where it is safe and possible. And we talked to that prior to the governor coming out with his report. We had focused as elementary, thinking that K through 2, K through 4 are very key to in person, and so that was one of our concerns to the onset. So the number 2 there is the health officials. We consult with them on a regular basis. They examine the county level, and those figures come back to us, and local information about outbreaks, community spread, and the groups of people becoming ill at the highest rates are all useful components in understanding how COVID impacts the community. And so we're moving along there. So then we move into number 3 is the evaluating the ability to implement the required and recommended health best practices. And so this is where we look at as a district is right now we're qualified for looking at required for in-person or hybrid learning. And these are the things that are required: masking policy, PPE equipment for direct support student services, and build routines of hygiene education and practices, daily cleaning and frequent cleaning of high-touch surface areas throughout the day, building level COVID-19 program coordinator, which for the district is Mr. Minton, and then limiting non-essential visitors and volunteers and external groups. Again, limiting the number of people coming in from that do not have employment there or is not working with the school. And so that needs to be regulated very carefully. Then discontinue large gathering and activities, do not allow for social distancing. So staffing or our student movement of our students, the type of, we want to eliminate large gatherings, we want to eliminate moving, allow the least amount of social distancing or allow for that rather. And then monitoring and excluding for illnesses. So those are the guidelines for in-person, which if the numbers stay where they are right now, if they're stable at that between now and the start of school, this is the plan that we'd put in place. And so, but this is a starting point. Then you see if we would go to the next level, which is a hybrid learning. And so you see the difference between the two, and the hybrid learning is social distancing of 6 feet and of all times in the school building. So we'd have to look at that, of changing that, and you have school facilities at a 50% occupancy. And that goes by the square footage that the fire marshal has with our classrooms, which is the square footage puts about a 40, possible 40, a little over students in a classroom. And so 50% of that would put it right around 20 to the low 20s if we were going to go with the hybrid learning. So we'd have to look at that. And then the sufficient staffing to meet all the requirements of the model. So that would be a concern. If we've got to go to a hybrid, we'd have to, in our classes, have smaller groups instead of 20. We'd have to put those into in another section, and so it'd put it down to the low teens. And so that would create a situation with finding teachers, staffing, and so forth. So we're aware of that, but that would be the next level. So And then determining the learning model to begin the school year. And that's what the focus is right now. And it says in making the determination of school districts should use a current incident command team or advisory council. We're calling advisory council. And this we just came out on last Thursday, and we were not aware of that. And we did form one, and you can see that the advisory council, what it consists of: board members, bargaining unit staff, students, and families. And so we put the administrative team has put a team group together that will serve as advisory council. And it's a group that will have to be called in a short notice if we need to meet for emergency purposes early. The learning model must be reported to MDE. So when we make that decision, we need to let the State Department know, and then they need to approve it. And the model and the plan will be posted on our district website, along with contingency plans for other learning model scenarios. There's 3 scenarios, and so between in-person, hybrid, and distant learning. So when we finish our plan, we will have the district's plan for each one of those. Because like we've said earlier, and what the governor said, this is just the start of putting this plan together. And then if the numbers change, and every Thursday, the numbers we should be reported by the county to us, to the district. And then if we see some major changes, then we've got to look at a different learning plan. And so these 3 are the 3 we would use. And so, and we have to monitor community and school level impact of COVID-19 on a regular basis. And so it goes through there. The decision to shift to an alternative learning model should center on the impact of COVID and at the school level. And I think it really brings the county together. It brings the state together, and all of us working for the common, for the support and the safety of our students and staff. So the district, if it needs to be more restrictive learning model, then that's required to notify the commissioner in the learning model portal within 24 hours beginning the new learning plan. So we're setting up a plan. Whether we stay in that will determine the numbers that is reported by the county. And so it'll be moved if we need to. And so that's something we're working on, a transition plan of from one plan to another. And so right now it's going to be in person. So if we were to have more numbers coming up and with the COVID-19, then that plan would have to be changed in order to take care of the safety of our students and staff and everybody involved. So that's, and then they go through the format or how to move from one scenario to another, and that's in there. Then they talk about the regional support teams. They have not been put together yet. The state is working on those. They are to be in place by the 24th of this month, and they'll be consultants for us to contact them when we have any questions. The health officials in the county will be working with that support team. There'll be members on that, and so we'll be using those people in making these determinations. And so in our advisory council will also be involved with that, and we're working with the regional support. So they've got a lot of support set up here, and so I think that gives us really strengthens our program and providing the service the best we can for our students during this pandemic. And so we'll appreciate that. So then they explain each scenario. Scenario 1 is the in-person learning. And so they go through that of what it takes, the impact of the school community in terms of confirmed cases among students, staff is relatively small. What situations under this?
Mr. Bransoy?
and are limited to individual classrooms or areas of schools.
Okay, you kind of froze there for a second, so we
Did I?
might miss some of that.
Am I on now?
You're on now, yes.
Okay. Sometimes it's I get talking and I forget that I gotta move it. Huh? Okay. And then multiple cases are identified, but can be linked to specific classroom or an individual activity with minimum impact. Then it can be changed. Multiple cases are identified, but are not linked to a clear alternative exposure that is unrelated to the school setting and unlikely to be a source of exposure for larger school communities. So that's our scenario one, and that's where we're at. Scenario two is a higher hybrid model. And when we originally started talking about this and looking at these three plans, this is the one where we thought we'd probably end up. And so we were looking at this and what does it mean? And it's a moderate to substantial community spread is occurring. And so this allows the social distancing for further mitigates the risk of transmission. And so what does it consist of? It's a number of students and staff who are all absent or sent home with influenza or COVID-19. Illness history reaches approximately 5% of the total number of student staff in a school within a single week. So that's the criteria they will look at there. Another one is significant community outbreak is occurring. And so that comes from our community members that will report on that. Then the last scenario that we need to have a plan put together is what we worked with last spring, the distance learning only, and we're going to call it online learning. And really it's where there's very minimal contact face-to-face or with the school building. And so this is where it's uncontrolled community spread and is occurring, and there's a significant degree of impact on the school community within the multiple confirmed cases and large-scale outbreaks. So we need to be ready for that. And what situations may necessitate a transition to the distant learning is that could be considered for short periods of time if confirmed cases are identified by contact tracing and notification close contacts in the school's setting. And then the second part of it is multiple cases are identified within a short period of time. And then then a significant community outbreak is occurring and has recently occurred. And the last part of it is to uncontrolled community transmission. And consideration for moving back to hybrid or in-person learning after a distant learning period. And then it's outlined there as how we can, get under control, then we can wait a minimum of 2 to 3 weeks before bringing any students back for in-person or hybrid learning. So they give the criteria there that we need to follow. What basically they're saying with these three scenarios that we could be in any one of those throughout the year. We start out with scenario one, which we're planning at this point. And if everything is good, the numbers are right, then we can stay with that. But we don't know. And this could change in the next week or two. And we follow the numbers that the county will be giving us, and we'll be working closely with them. That will dictate what scenario we need to go to or whatever. So we need to be flexible, and I think I encourage parents to follow this very closely, and we need to be flexible and look at how can we keep our kids safe. And I think we always encourage students, even if they feel a little ill in the morning or if they're not feeling just up to par, to go to school anyway. I think that'll change this year. I feel that if your child, your student is gets up in the morning and you check the temperature and they have a temperature, well then don't second guess it and send them off. Take care of it at that moment, and maybe it can stop and maybe it is nothing, but be cautious. That's something that I think we're telling everybody, is that if you don't feel well, don't try and come to school, and take care of yourself first, and then we can move on. So then they explain the regional support teams. This is something that the Department of Health and the state are working together, and they'll have regional service co-ops, and we've already have contact with them, and so they'll have them organized by the 24th of August, and then we'll understand more of what they're going to be doing, but there'll be consultants for us regarding the implementation and ongoing evaluation of our different learning models. So we'll work with that. And the team structure is made up of rapid response staff and health consultants and testing event planners. And so it outlines those in that information, and really meant to be consultants for us. And I really appreciate that, because with an epidemic like we've got, the crisis we have, we need to have a lot of medical people involved, human services people, county officials, as well as state and federal. So then we get into face coverings, which, right now face coverings are mandated across the state. That was the last executive order by the governor, and so this outlines that, and the state is going to provide every K through 12 get one cloth face covering, and every staff member will receive one cloth covering. Then every school will receive 3 disposable face masks per student, and every school will receive face shields for all licensed teachers and 50% of non-licensed staff. So that's the state is going to be distributing that through our region. And so they've been asking for the numbers, and so we have to submit the numbers that we would request. So, and then responding to the next part is responding to confirmed cases, and this is what we need to follow. And again, we'll have help with our county working with us. They'll be our direct contact, local public health and MDH officials. Through the regional support team, will be working, will identify whether persons who was ill was present on school grounds while infectious, and whether they resulted in any close contact for exposure. And then in addition to that, they have identification situations there, and they go through each one of those. How many cases are there, and are they close in time together or spread out over several weeks? Are new cases traceable to the school community, or are they likely the result of a different exposure, household exposure, travel, or whatever? What are the cases occurring? Where are they occurring, and how? And who do they have do they have any common themes? How many close contacts does each case have? Are students, parents, and staff forthcoming about close contacts? Is there a significant COVID-19 transmission in the surrounding areas? And are they able to maintain your current learning model based on staffing? So all these are just questions that they're going to be addressing and working with us, and so we'll need that type of support in bringing students back to school, and so we'll work with that. Testing process, they go through that. There's a lot of question marks there, and the health department's working with that and monitoring and testing. And we're fortunate we have the clinic here in town, and so in the hospital here, and the county officials will be working with us on that. So, and then this partnership and strategy, it talks about there with the State Department as far as testing educators and school staff. Their comprehensive testing strategies and scenarios and thresholds. They go through all those, or you can go through that on your own. And then on page 15, talks about the go through the potential scenarios we talked about, the limited exposure, less than 50 close contacts, more than 50 close contacts, influenza like illness more than 5% or non-linked 5+. And so testing recommended. And again, these are all, I feel that we will go to our county and be working with the county health department in the testing and the coordinating of that. And we are looking at hiring a full-time health aide to be in our buildings at all times during this crisis situation. So, and then page 16, we start with meeting the needs of students and families, and it talks communicating the plans with the student and families. And so the school district must post and communicate with contingency in-person learning, hybrid learning, and distant learning plans. And so that all has to be posted and has to be no later than 1 week. I think that has been changed. I think it's 2 weeks, I've been told, but here it says 1 week be prior to school. But we'll get that information out as soon as the board approves it. The board has to approve the plan, and so we'll get that out as quickly as we can. But the planning at right now is to take it to the advisory council tomorrow, at tomorrow's meeting, have them go through this and see if they have recommendations for any changes or any concerns. And if not, then bring it back to the board as a recommendation to accept. And Jill and I have talked throwing out Monday night as a possible special meeting if the plan is ready for approval. So we'll be talking about that. The school board and association has put out a policy, and I emailed that out this afternoon for your information, so you can review that, and then that's what we would put in place when we meet as a board. But it needs to be approved by the board. So they've got some information on ensuring access to service and resources. That's a big item with the State Department, with the health and education department. And so we can read through those. If the parents elect not to send, and we do have some students that would prefer not exposing their students to school, and that is an option they have. If they do that, then we're still obligated to provide an online learning for those students, so we would do that in one fashion or another. So that's what we're working with and going with that. So a little bit about the funding that you can read through, the different funds that are available. We're working with that right now. We did get some additional funding for last spring. It came through the CARES Act, and now they're trying to finalize that. We don't know where that's at this time, but some of the funding that they're looking at is listed here, and the state and the federal are all looking at what type of funding they're going to be able to provide for our schools, because we're providing an awful lot of services that we normally do not have. And if we have to go to hiring additional staff due to the outbreak, if we go to hybrid, or then we would have to have additional staff, and we have class sizes of 10 to 15. And so we need to look at that. So, and then the government.
I got a question about that CARES Act. Don't we have to fill out the paperwork for that?
That's all been taken care of
Oh, you did
up
do
to
that.
this point.
Okay.
Yep.
Okay.
The CARES Act. Yeah. And there's also some CARES Act that the county has contacted us, And so they've got some CARES Act, some dollars from the CARES that are to be suspended or dispensed to the schools too. And so there's some funding there possible. And so there's quite a different end. And this is something that Lindsay works very close with, and we're working together on that to make sure that the funding that is available, that we're applying for that. So yes, thank you.
Okay, just wanted to make sure, thanks.
Yep. Okay, then there's some resources on there, and I told the staff this morning is that the department, both the health department and the education department, have got tons of resources and to look at. And their first original guidance for back to school through this pandemic it was 100 pages long, and one that came out on the 30th is they added 11 more pages to it. So they made some changes, some corrections, and some additions. So it's changing often, and as you read the numbers in the local paper or hear on the radio, the numbers have been increasing. And so I think the masks, this social distancing, the cleanliness of hand washing, and often those are three things that we have to really encourage families and students of that to adhere to those guidelines. And in all the resources we've got, they're the top three things they're saying is social distancing, cleanliness, and so forth, and the masks. So the State Department is going to do what they can do to help us, and they've got a ton of resources out there, and so that's all been good. So I'm going to stop there. We've like I said, the advisory council will be meeting, and they've been contacted and have agreed there. And the group is outlined there of the representatives they are, and so it's board members to students, family members, and then public health is included in those. And so I wanted to go through those because when we give the plan that will be submitted to the state will contain a lot of this information. But they'll include, what in-person means and what does it mean for bold. And then the hybrid, what if we go to hybrid, what that would mean for bold. And then the distant learning or online learning. And I think everybody got a taste of the online learning last spring. And I reminded the staff, that was a very, I think, tough situation for everybody because we'd never been there before. And all of a sudden, the students were gone and we had to provide. And it was really difficult. Our staff did just an outstanding job. And so it is tough to meet the student needs if you can't be face-to-face. And we all know that. Our goal, one superintendent, one of the Zoom meetings this week I was on, he said, the goal of all of us, the staff, the teachers, parents, and students, the goal is to be in person. We know that. And so what can we do to help preserve that? And I think those three things I just mentioned are three things that if we all do our part on that, then that we can keep this at a low number and hopefully stay with this in person that we're going to start with. So. Jim, we had some survey of parents, and some about staff that went out, and Jim has got the results of that. Mr. Menton, would you want to talk a little bit about that? Jim, Mr. Menton?
He's here.
Is he?
Yep.
Okay.
There we go.
There we go. I couldn't find my mute button. It moved when I shared my screen.
Okay, go ahead.
All right. I'm not sure what you're seeing. Are you seeing?
349 responses.
Perfect. Okay. Yeah. So we did ask that We try to reserve or keep one survey per family, just so we could try to keep the numbers of students relatively accurate. We have no way of knowing if we had more than one done per family. So I'm just going to make the assumption that that we had one of these per family. I'm sure there's a margin of error. I've learned a lot about making surveys, and one of the things is you can proofread it with your entire admin team several times and still make mistakes. For the first, I don't know, half hour of the survey, there was no place to put 8th graders. And there were a couple other people were emailing me, hey, did you notice this? Nope. And so I'd get it fixed. But basically, some of the things we wanted to know, kind of family makeups, you know, who was working from the home, who was working outside of the home. I did break down numbers, and that based on how many people were going to be sending their kids to school versus how many people were going to be keeping their kids at home. And I really didn't see much of a correlation between single parent families and 2-parent families, or families going to work and families staying to work at home. It didn't seem like there was a huge correlation with that. We asked them to rate their concern about their own student safety attending classes in person. And as you can see, the 35% were the very lowest, 57 or 16% were at the very highest. So there's a decent amount of concern out there. We asked, if the situation does not improve before September 8th, the first day of school, would you be sending your students to the building? We have 77%, 78% saying yes, they're going to send all of their kids. We've got 17.8 saying that no, they're not going to send any of their kids if things stay the way that they are right now. And then the other group is, I'd send some but not others. And that's kind of why we asked some further questions about the family makeup. If they have, if their kids are in a high-risk health category, that's where this is. So we do have about 10% of our student body who they qualify as one of these high-risk categories. And that could be, maybe they have diabetes, asthma, there's a bunch of them, heart problems, and so it could be that a family has one diabetic child and another that's not, so maybe they would consider sending one to school and keeping one at home. We also were trying to find out a little bit beyond that, because we're finding with our staff, there's a lot of staff who have not their own health concerns, but they live with people that have some major health concerns. And so we were kind of curious with our own students, and you can see that 20% of these 349 respondents said that yeah, they have somebody directly in their home that is in a high-risk health category. And we decided to take it one more step and just, are you concerned with somebody else close to you, maybe not living directly with you? And you can see that jumps all the way up to 31%. So there's a lot of concern out there, and it's important to consider that right now, the way it is, almost 20% are just saying, no, I don't feel comfortable right now sending my kid to school. So that's telling us that we really need to look at how we're going to provide instruction, both to the 75%, 77, 8% that are coming to the building, as well as what are we going to do for those that aren't coming? Because if they were to all decide, hey, I'm going to do some other online platform, that would hurt us quite a bit. So, any questions about the survey?
This is a survey we just sent out, a quick one here, and as we make the final decision on the plan, and then when we send back to school, be more specific with parents and letting them know what options there are. So, but this gives us an idea of planning of what we see. So, most of the districts I've talked to, these figures fit right in with what they've had. So, very similar.
So, Mr. Minton, were you able to kind of get anything out of this survey if they were younger students, older students, or?
I'm glad you asked that. Yep, I actually broke that all down here on a high-tech notebook piece of paper. I know. So yeah, I can tell you basically by grade level or grade grouping. For example, in grades 9 through 12, there were 150 people that had a student in grades 5 through 12, 9 through 12. And of those 150, 122 or 81% said, yes, we're going to send them all. In kindergarten, I think we had a fantastic response from our kindergarten parents. We had 41 people say they had a kid in kindergarten. 32 of those 41, or 78% of those say, yes, we're definitely going to send them. There were 6 that said, no, they're not going if things stay the same. Likewise, in grades 9 through 12, there were 13% or 20 people that said no. If things don't get better, they're not going to send them.
So would we be very capable to teach those younger students online, and rather than face-to-face?
Yep, we're going to have to with those kinds of numbers. I'll tell you this: it's a lot easier to teach the older kids online.
Correct.
I'm not saying it's a great way to go, but it's a lot easier the older you get. So
I think
we're
when
going to
we
do our
first,
best to make this as best experience possible for those kids that are staying at home. You know, they have to understand too, if they're keeping their kids home while everyone else is in school, it is going to be a little bit more work for parents, but I think that that's just one of these things that we're having to deal with. Everybody's suffering in one way or another here. So,
and I think being flexible and knowing each other's obligations, and we talked about that. If we come back in our in-person learning, is to that first week is we have to spend some time in talking about all these situations we're in right now, and to respect each other and have flexibility and take care of a lot of these things you can regulate yourself. So, but I think when we first started looking at this 2 months ago, whenever we were looking at the 3 scenarios, and we were looking at very seriously, I think, the hybrid type where we would have both in class and then the online learning. But one of the focus was for the elementary is we wanted to, if at all possible, bring the lower primary grades in because of learning, and Mr. Benson could address that. I think he was one that was really focusing on that as far as the younger grades. There's childcare issues there, and then what can a kindergarten, first, second grader do on their own, and so they need a lot more guidance. So that was a focus to begin with, is what can we meet with the primary ones of meeting their needs first.
What about the ECFE, early childhood?
we only had 13 people respond from the ECFE. So it's not a real, like when you get half of your high school to respond, you can pretty much bet that number, those percentages are going to be accurate across everyone. With only 13 people from the pre-K responding. I don't really feel that that's as solid a predictor of what the whole group's going to do. That being said, of those 13, 9 said that they would send all of their pre-K kids to school. One person said that they would send some of their students, and 3 said no, that they would stay home. So that's 3 of 13 is 24%.
Sandy, did you have a question?
Yeah, I did for Jim.
Okay.
Would it work? Like, it wouldn't be any different than an online learning like they did last year. Could the teacher take their computer and have it facing in the class there as they're having their lectures and things, and that student keys in to that class at that same time, so they would still get the learning, and they'd be in the same class but not actually sitting there? Would that something like that work?
It could work. The problem, and I wish I could get paid by the number of times I've had this same conversation with people. The problem is that what makes good classroom instruction is not good online learning. So yes, it's certainly possible, and we may have to look at doing something like that. But it's tough to sit at home, especially if you have to, imagine keeping a preschool kid, or even an elementary or middle school age kid, or for that matter, a high school kid, to sit for 8 hours of the day watching a TV screen. That would be pretty tough. It's certainly doable, but I think we've got to look at going a little beyond that.
I think what we have learned, what we learned from last spring is how important the face-to-face is in learning. And I think that's what we all agree with that. And that is not, and so online learning, how can we work with it? And I think that's what the staff is pondering, and that's what they're working on. And so, because we know we're going to have some of that.
Right.
And so.
Well, I was just talking about that 17% that we're losing, that we're missing there.
We have to provide for them, so yes.
Right. So that's the percent I was looking at. Maybe we could do that extra and above, but.
Yeah.
And we're certainly going to look into ideas like that.
I think we don't want to forget that early childhood either. I think that's a pretty good percentage so far of kind of how the classroom's going to go, isn't it, Jim? Yeah,
absolutely, and that's such an important program for our schools. If you neglect that, you're dooming future generations of kids. We as it is, I don't think we spend nearly enough as a country on our pre-K programs. We should be expanding them immensely so that we don't have to pay for our prisons.
Right. That's why I think it's very important we keep them involved in this whole scenario, and because they're a vital part of our school in the future.
And I don't think anybody is saying that they're not going to be part of this. So we'll just have to, I know Lindsay and they will probably reach out to their parents and find out maybe a little more info. That's just a guess.
We had a meeting today. Derek and I met with Lindsay this afternoon and had a good talk, and she's got solid numbers. And so what we talked about was a big part of their program is social. And a lot of parents will want their child in there simply to be with other kids and to learn to share and all those good things. And so we talked about that. Now, how do you deal with social distancing with that young age? And so she does an outstanding job. There's no doubt about it. We have an excellent program, and so we'll support her in every way we can. And
so what was her thoughts on social distancing?
Well, they just have to respect that, and they'll do the best they can, you know, to keep that distance. And the kids will understand that too. But it's just something different, and what we have to get used to. And I heard this morning a doctor talk about research, and he made that comment. He said, "Look at all the childhood daycare centers operating in the state of Minnesota." But he says we haven't had a virus outbreak with any of them. So he kind of lent it to maybe they're quick learners. And maybe by giving them the responsibilities that they've respected it. And so I thought that was kind of interesting to hear that, but we never thought about that. No, that's an important program. And so she's looking at what she can do to make it good for kids.
I would add to that, Dale, too. People are used to taking extra care around little kids.
You know,
So I think that probably enters into that too. You know, you don't just send them out the door on their own. You're walking them by hand and taking really close care of these little ones. So I think that comes into it as well. You're already doing this, so doing a little extra hand washing and temperature taking it's not that big of a deal. And they don't know any better, so they play along.
Okay, any other questions?
Yes, I had a question to Dale on the masks. You said there was like 3 per student, Dale, or
say that again.
The masks?
The masks. How many masks per student?
Oh, yes. That's what the state's going to provide.
How many?
Okay.
And so every student will get one
Cloth.
mask, and then they'll each get 3, or there'll be 3 available for use for
Paper.
they could get them or whatever. So I don't know what that's going to consist of, but that was just released on Thursday too. That's the first we'd heard of that. So that's kind of interesting. But
So my question is, Dale, is 3 enough?
probably not.
Okay.
We have to educate all of us on that too. And so I think we were thinking early on that mask would be something that would be back to school materials, a requirement for all students. So, you know, I think we need support with that, with the parents, and, you know, they can't have a mask that they can wear for a week. You know, that has to be washed daily or whatever. And so that's going to be
That's kind of what I was worried about.
Yep. So, but
Okay.
so I think how we're going to deal with that, you know, that's going to be a real challenge. And so, good questions.
Okay, anything else?
I just want to comment and thank the administrative team, the maintenance staff, all the staff for the amount of work that you guys are putting in to make this thing, you know, hands-on to the community and to the board, and, you know, just making it so clear. And it's got to be tough, and I can't imagine the stress that you guys are under right now, but I really appreciate what you guys are doing, because you are completely putting kids' safety and the staff's safety first. So thank you, and we will definitely get through this. And it's uncharted territory. We do not know what tomorrow brings, but we've got to stick together, because it's the only way it's going to work. So thank you guys very much.
Thank you.
I think
Anyone else have any?
So true. We've got to work together on this as we move through it, and we can get through it, but we got to work together. And parents have got a big obligation, and the staff, and to keep us all healthy. And, you know, when we look at our staff, we've got bus drivers that are of an age where they're in a group that is tough to get sick. There's a number of staff that have got medical issues that we're concerned about, and they're concerned about, so we have to deal with that. And, you know, if we don't have enough cooks to provide a meal for a day, you know, we have to look at that. What are we going to do? So There's a lot in it, and I think as a board, I appreciate your listening and, you know, read through the materials, and when we come back with the plan, it'll read through that and try and understand it, and thank you for that.
Okay, just recap on next steps. So the advisory council meets tomorrow. And hopefully, I guess it's just my goal. It's not a goal that has to necessarily be met, but I would like to get the information out to parents as soon as possible. And we do have to pass, the board does have to pass a resolution. So I'm hopeful that the advisory council can go through the information tomorrow and be able to make that recommendation to the board for a possible special meeting Monday night. So stay tuned. That's not a given. Just want to keep going here so we can provide information to our parents as soon as possible, so everybody can ease their anxiety level a little bit about this.
So Joe, with you saying that, are the board members gonna, once you bring that back, if we have any questions, is there any alternative or what? From the advisory board?
Well, I suppose there's always an alternative, but if you're gonna have the administrative team work with this plan and give it to an advisory board, you're gonna go back on it? Maybe I'm not understanding what you're saying, Jeff.
If we have any questions on any of the information brought up, and can we indulge in that, or?
Well, yeah, of course.
Or, I mean, for the next meeting, we'll have enough time to go over that, or what? Before
It'll be a special meeting like this one, so I guess we can build that into it. So
If you, the scenarios are spelled out very well, and if you want to go into the State Department's planning guide, that 111-page document, they do a very good job. They'll take each scenario and they go through everything from transportation to nutrition to classroom to all of it. It's very thorough. So if you have an opportunity, go on the State Department website and you can get that and take a look at it. And it really spells it out. And like what you're saying, Jeff, it really answers a lot of questions, but there still is a lot of questions. I spent about an hour or better on Friday with a Q&A with the School Board Association. It was just all superintendents asking questions, and it was over an hour. And then on Saturday morning, we had another Q&A, and that went for over an hour. And so there's lots of questions, yes.
Mr. Bransoy really likes long meetings. Anything else on this? I mean, it's a lot of information, and thank you guys for laying it out for us. So let's move on to number 2 and discuss and review the Bold School Survey results. I'm going to turn this over to Mr. Bransoy to start with, and with input from our board members.
The survey Sue presented it at the last board meeting and went through it all. And so then from that, we said we would meet again and you would have time to go through the survey. It's on the website, the results. And so I hope you've had an opportunity to look at some of that. And if you've got some questions, we can address them. If not, we'll get the answers for you. But I just want to start out and say a thank you to all the Bold residents. I think the number that participated in our survey was outstanding. I think the district received over 700 combined surveys. We were right at about 31%, which is very high for a mail-out survey. Sue said that normally if you get above 20, you've done well. And so she was very pleased with that. And it shows that people are interested and they want to be part of the discussions about how we invest in improving our education. So I think that's a couple of key things that I think come out of that survey. So with that, I think maybe it'd be good to give, Jill, you can, if you want to give the board members each just a moment to see any comments they would have, like a comment that what they liked, what they saw, and maybe what they did not like, and then what they found was interesting, something surprising. So.
All right, let's go with it here. Anyone want to start with basically your highs and your lows and what you found surprising of the survey? What was interesting? What was not interesting?
I think just seeing that there's a very high support on continuing to invest in our, our education and what we can do to make it better, and seeing that, there's 69% that believe we need to update our buildings. It's important to them. I think that was very huge to see that. I know there was about 20% that are still undecided, and I guess that's my biggest concern right now, how we can reach them, what we need to do to effectively communicate to them, just because we need to engage their input and try to help them with their questions. So what is our plan for that? That's where I'm coming from with my biggest concern right now.
Okay. Anyone else?
I had a phone call that mentioned that same thing. What is the plan and how is it getting portrayed to the public? Because the public don't know what is coming and they don't know how to vote or do your survey because of the lack of information on what kind of building they're talking, if they're talking remodeling, but they need something in the paper or something showing what it looks like. I mean, I know us as board members have gotten something way back when, but in order to sell the product, they feel that they need to see the product.
Okay. Anyone else?
Yeah, just to tag on to what Jeff was saying.
John, can you speak up a little bit?
Yep, okay.
Thanks.
Yep. I was somewhat surprised that the category not sure need more information and the percentages that were in those categories. I'm just looking at 2 pages right now, and all of them are above 20%. And it just kind of surprised me that there was that much of that number were not sure and needed more information. Just an observation.
Okay. Anybody else have any input?
The numbers show that that 68% is pretty localized, but not completely with the parents of the district. I think we need more input of that to make a better decision.
You feel we need more input from the parents?
Correct.
Okay.
Because they're the ones that are sending kids to school, so.
Tracy or Jamie, do you guys have anything you'd like to add?
I guess I too, Jill, I think the percentages, the 20% of the not sure need more information are the ones that we really need to, I don't know how we go about doing that, but get that information out there. And, those are definitely the ones that can go either way. So.
Right, how do we reach them?
How do we reach them?
Yes. Jamie.
Yep, I agree with that. My only concern is we've sent out 2 surveys. I don't know how else we get to parents.
Right.
I mean, I like the idea of trying to get to them, but how do we do it? We've sent out surveys. If they don't respond, we can't.
Right.
We can't go knocking on their door.
Mm-hmm.
Well, actually you can, but.
I mean, yeah, we could. But,
actually you can, you can.
I mean, I'm not sure that I have a lot of time for that.
No, not maybe you per se, but.
Well, no, anybody. Like,
Right.
I don't know how we go about it. Like how.
Well, and that's why we have ICS as part of our arsenal of people who will give us ideas of how to do this. So anyone else want to speak to anything survey related?
Sandy, you got any thoughts?
What was that?
Sandy, got any thoughts?
Oh, I'm sorry, Sandy.
Uh-oh.
I'm sorry.
Everybody's just basically said the same thing, so.
Yeah, that's kind of how I was too. So, no, good discussion though, you guys. This is good.
I think that's some good summary of, I think that's what people have shared with me that have looked at it. And so I think it's a common theme coming there. And, but one thing that I think really jumped out was everybody says there's a concern or have a problem with the quality of our buildings. I think that was evident too. And I think when they look at 69% that you mentioned was wanting to needed to upgrade our buildings, I think that's a pretty strong percentage saying, you know, what direction should we go? And I think that's what we want to look at is we're moving forward now. What direction do we want to go? We do have an opportunity here and to work with a partner. And so with the hospital there, and that was really received some high ratings with the community, the representatives that did answer this survey. That was a very strong hold. And so is that something you want to pursue? Do we get the facilities committee back? And now we talked about doing that after the survey. And I think the lack of information, I think some of that was the timing of everything that, you know, we were ready to really move on it in March when we had the survey ready to go out. We as a committee, as a board, had set the goal to get the survey out and then look at the results of that and get some direction from that. Well, that all hit the end of March, and everybody knows what happened at the end of March. Everything just kind of stopped. The hospital, the school district, we had to send all the kids home, and kids said goodbye to school without even having a chance to say goodbye to their teachers. And it was a tough spring. It was hard on all of us. And so I think that didn't give us the opportunity to communicate. We were not able to have gatherings. We couldn't bring people together, and we aren't to do that at this point yet. So I think the idea of a lack of info, I think, is very true. And we were just at the point of starting to dig into those sorts of things, and it was halt. And so, but I think we need to take a look at moving forward. The hospital is in the same boat we are. They're going through some major changes with their lineup right now. And so, but Nate has shared that they're enthusiastic about the project and wants to continue working with us. We're Ryan and I think Ryan is on right now with us, but we talked about looking at an MOU, and they're not quite ready for it at this point. And so, so that's something we have to take a look at. But I guess I'm looking for some direction from the board. It was very clear that something needs to be done with the buildings. That was very evident. And so I think we need to follow up with that on the survey and try and move forward. So.
Yeah, Dale, can I comment a little bit yet?
Yep.
We were talking about, I know somebody mentioned to me, with this building project, is it necessary to pursue it as fast as we are because of what situation we are in? If this COVID stays around, do we need the buildings or do we not? We don't know that answer at this point. And that's what they brought up to me. I don't know. What's your take on that?
Ryan and I have had that same discussion, Jeff. So we're kind of all on the same page, and that's what, we go back to where we were last July. And so it's kind of like we've stalled throughout the year, moving forward, and then something comes up. And so we've had some hurdles we've had to get over, and we kept moving forward, and I think we need to do that. Whether once the timing, I don't know. You've got some real tax advantages right now. You've got some contractors that are looking for business right now. You've got low interest rates. All those factors in building are important, and in long-term investments like this can make quite an impact. So all those things, but I think we as a board, if we're going to move forward, need to be all together. And I think you need to be unanimous whenever you're going to go after a project like this. And so I think the survey tells us a lot. And so I like the idea of wanting more info, and it didn't come back no. It didn't come back anything negative. It just said we need more info and most of the important questions. And I thought that when I think about the situation we're in, it wasn't, I didn't feel it was a surprise. I just feel that that they want to have information, and we were just at the point of starting to do that with the survey going out, and then we're going to come with the information about a facility, and so they had minimal, and about the only thing they had was the tax impact and the total cost, and there's a lot more to it than that. So, Ryan, are you on board, or?
Yeah, I'm here.
Or did I lose you?
No, can you hear me?
Yep, we can hear you.
Yeah, I'm here.
You've heard comments from the board members and myself. Any reaction of yours as far as the survey that you had takeaways?
Yeah, and hopefully, I'll try to address. I'll try not to monopolize the time, but the survey to me said exactly what it should have, because if you think about everybody that's not on this current call, we haven't communicated really at all. We haven't put forth an effort to talk about what the partnership with the hospital or project might look like, because we've been working with them to understand what that might look like. So to me, the response of "I'm not sure, I need more information" is exactly the response that we should have got, because the people out there in your public, they haven't been communicated with, and that wasn't purposeful in the ways of keeping them in the dark. It's purposeful in the ways of there's nothing to communicate yet. And as Dale said, as we got into March and we were talking about this survey, that was going to kind of jumpstart that whole communication process. And we're going to do that throughout the summer. If you remember, we talked in January about that. And then, of course, the brakes were hit on everything. So rightfully so, when they get a survey in the summer to say, "I'm not sure, I need more information," yeah, they do, absolutely. And to hopefully your point, Jill, we have a communication plan of how to get it out and how to message to the public and discuss what a plan would be, and all the ins and outs of it, and all the questions and answers that people will have. That's a completely normal part of the process that we actually haven't got to yet. So yeah, I guess maybe I feel good about that kind of response. Getting still a strong response and saying, yes, there needs to be something done, and we support that the district looks at facility improvements, but we need more information. Absolutely is something that I would expect to be part of the survey. So and something that I fully have confidence that we as a company and you as a district will be able to fulfill for people and have them understand what's going on. So if it means anything to the people on this call, I feel good about that. I feel good that we will be able to communicate and show people what's going on. Jeff, to answer a couple of your, or maybe comment on your questions, when people say, what's the plan, what's the building look like? Unfortunately, that's something you're not ever going to see before a successful referendum. It just doesn't work that way, unfortunately, right? And we've talked about this at previous board meetings too. It just, number one is any sort of new building would be designed by the people using the building. So that process needs to happen after that project approval is complete. You wouldn't pay architects hundreds of thousands of dollars to design a building that you can show people that you then need to go out and get voted on and have that voted down and maybe never happen, right? It just won't happen. Districts do not do that. So you need to rely on the concept that after a successful vote, the community, the staff, the administration, the board, the businesses all get together and design that building together. So it's purposefully done that way, and that is how it happens everywhere. So hopefully that makes sense and is understandable. As far as your COVID comment, districts are struggling right now. There's a lot of districts in the state that are trying to figure out when they're going to go out for a referendum, how to go out for a referendum. They paused their referendums in the spring because of COVID and now have not gone back out. So they're trying to decide. It's a difficult conversation for your specific buildings. Remember, this process is a long process. So even if you were to say, okay, what we're going to do is run out and we're going to have a referendum tacked on to the election here in November. If you did that and were successful in November, that new school wouldn't open till the fall of 2023. So think about that. That's 3 years away. So it isn't as if, oh, do we need it now? It's, do we need it in 3 years? And with the current facilities, there's a lot of work that needs to happen there. I don't think we all understand that. So delaying the process to get it going is also delaying the implementation of that ultimate plan, which is something to consider. Besides all the comments that Dale made about interest rates and things like that, and one of the things that happens here is a project like this, which is sizable for your communities, it actually creates a little economy within your community. If you think about all the jobs and all the construction trades and things like that it brings into your towns that then use the facilities in your towns, it helps, right? It provides a little booster or potential, it evens out the storm of people that might be hurting a little bit right now. So it's tough to rely on that and have faith in that, but think about how America happens in hard times. As they start infrastructure projects, they start people working to start building back up communities, and that this is similar to that. So I don't know, maybe if I got off the soapbox a little bit there, or if I made other questions.
You answered my questions, and I understood that to a certain degree, but what was brought up was, do we need them buildings if we're just going to do online learning? Basically, that's where that came up.
Yeah. And obviously that's more of an administration question than a question for me. What I do know, similar to your district, we're involved in a lot of districts that are doing similar surveys with parents and staff and students and things like that. And what the state has done with surveys, I can tell you that the overwhelming response in every survey that I've heard is that parents and people, I'll generalize, think that in-person learning is absolutely the best way to go about things and absolutely needed. So whether that's being done a little differently right now to understand how we're going to navigate this short period, fine. But the emphasis of having kids in buildings for their educational purposes is something that has strongly been, in support of.
I don't disagree with that, Ryan, not at all. But it's the dollars is what I was looking at in the time we're in right now.
Mhm.
I don't know how long this is going to last. If you know,
No
you're
one-
better than I am.
Sure.
Got the magic wand? But no, good discussions, and I think, and I think we need to use this survey to answer some of those questions, and then, like I said, getting information out is a must, and I think that's when you can answer the questions and get them done, and so I think that's a big one, and I think, like Ryan and I we both said, is that we're just to that point in March, as we noticed when we had the 3 companies in to look at what recommending for the survey. We just gotten done with that and gone through all of that, and got excited about getting that out to the public and ahead of time so that we could take on the campaign. Well, then, boom. We all know what happened, and so so we need to make some decisions, board. What do you want to do? And like I said, I think it's a time. We're in a time with the pandemic, with the crisis of everybody needs to come together, and I'm asking that for our starting of this fall. There's going to be some. Everybody's got to realize what our role is and getting through this. And so, and this facility issue is something that we need to work with too. So I'll stop talking for a bit.
Mike, one quick comment. I firmly believe that we need to continue with discussion on this and continue putting a plan together, because we've invested so much time and energy and finances into where we're at today. And we did hear back from, a good majority of people that want us to continue to do work on this, and we owe it to them. And I just feel that we have to work together and continue with discussions. And we do not know a time frame right now, but we have to continue talking about this and put a plan together and stick to it.
I agree with you, Melissa. And I also feel that we shouldn't let COVID, dictate moving forward with this project. I think we need to keep moving forward with this project. I don't think any of us are thinking that distance learning is going to be, the new way of the future. So I think I agree with Melissa. We need to keep moving forward with a plan on this project.
Ryan, would you want to talk a little bit about timeline or such? I put down a comment, or item number 3 was to take a look at a review and comment. And a review and comment is simply sending a plan to the State Department for MDE to look at and to review, and before you can go to going to a bond or a project like this. So
Yeah,
we to that point.
Yep.
Can we be?
So that's on there, and as Dale said, the deadline for a review and comment for a November election, November 3rd this year, is Friday. So obviously that's a deadline that is probably. I wanted to be part of this meeting because if the board was very adamant that now is we can't wait, we got to go. We heard some information and we're confident that we can communicate the plan, and get it to the public. So we need to take advantage of every time opportunity we have. That's why I think Dale wanted to include this on the agenda today, understanding that that's quite a quite an ask, and we could put together a review and comment. It wouldn't be as detailed potentially as I might want it to be with any sort of how a functioning project, school and or hospital related would work, but it could be done. There's a lot of details to work out with that before going to a review and comment for me. So that's why we're talking about it now. If you move on to what's the next opportunity, that deadline then falls to basically, think about it, I think it's November 1st or close to November 1st for a February referendum. So
Ryan, I have a question.
Sure.
So can we put together a review and comment at this point and then work out details after, so that, because we know it has to be done, right? Like,
yeah,
I mean, you just emphasized that.
Yeah. I mean, so and we submit review and comments all the time, right? So we know what the MDEs looks for. We know what the requirements are. Yes, we could submit a review and comment and then still foster and develop how the partnership or project, co-location and all that would work, and then supplement the review and comment or add to it at certain points. That could happen. I just think it's probably something that I'm one that's very much of the mindset of I don't want the Department of Education asking questions, right? I want to provide them a plan that works, and they don't have to try to figure out what's going on or when it's going to happen or anything like that. I want to get it in there and it, and have as little discussion with them as possible. There's always a question. They always have a question, right? They have to do that. That's part of their job. But so yes, Jamie, we could do that, and I think we could be fine. I really do. So if the board was really wanted to sit here tonight and just be very passionate about wanting to go forward, I'm not going to get in that way. We'll get it done for sure. It just would be a little bit more labor, I guess. And don't get me wrong with that word, as far as cost. It's just there'd be more work involved with getting that to flow and everybody getting on the same page, and then communicating that with the public. Again, I would rather just not have a lot of question. I'd rather have a real solid, here's how this works. And that way people can understand it, as opposed to, well, we're still working on that for a little bit longer, right? Again, is that possible? And could people in the public understand that? Maybe they could, and that'd be fine. And get that all done by November when they vote. Yeah, it's possible. It's probably a little pie in the sky, but again, if you guys were all here saying, Ryan, we got to do this, I'm on board. Let's do it. Would February be a better time frame and a nice spot? Absolutely.
My only concern is the voting aspect of it, right? Like, so you have your voters that come out for all sorts of elections, the presidential election, so on and so forth in November. I don't know how good of a turnout you're going to get in February.
Right.
That's my only concern.
Yep. And that's a hard thing. Hard, in any election, is to get people to vote. And unfortunately, that your support typically are the people who don't vote. So it's even, November would probably be good in that case, because any typical district support people in this particular election might actually be going out and voting. So yeah, it would make sense to take advantage of that, of course. And if it's not done, again, that's our job, is to help educate and get people out there and get them to vote. That was part of that whole survey, right? Sue takes out the parents and the staff because they don't vote. That's why she pulls that group out of all those responses, so you can see what's left over, because that group they just don't vote. They don't represent well at the polls, and You know, even though you might have an overwhelming majority that shows support in a survey, they don't go vote and tell you that. They don't put the, you know, proof in the pudding, basically. So that's the hard part for sure in an off general time election.
In February would definitely give us that time to get out and educate the public. And, you know, yeah, we're just going to have to get people out and voting.
Right. Yep.
So
And
what's
again,
your wishes?
that might seem like you know, we've, as we talked about in Dale's, we've been purposefully not going overwhelmingly, you know, with the communications right now. There's other things on people's minds. There's, you know, so we're trying to establish, we set up the website, we've done the survey, we've started to do some of the things that we were going to do just to keep that going, and let them and keep the momentum or start the momentum. But yeah, there's a lot of communication yet to come for sure.
If this review and comment would be approved now, do we have the ability or authority to still postpone it to a late, you know, to that February date, or would this be a lock-in for November? I'm just wondering, like, what flexibility we have,
Yep.
or we could go through this whole process again. How does that all work?
So I'll two different answers to that question, because some of this actually did happen in the spring. If you were to say, yep, let's go ahead and submit a review and comment, and just to let you know, I'm working with Annandale Schools, and they've done that, said let's submit the review and comment. They have not approved an actual referendum yet date. They did have one in May set, but they canceled it in March. So I'll get to the timelines that you're talking about. We can say, go ahead and submit the review and comment, go ahead and get it in there. Then in a couple weeks, the board could decide, nope, we're not doing anything. The deadline for the actual resolution that you have to approve is August 21st. So again, little history, the review and comment comes first. The resolution of the actual referendum election is later, August 21st. Okay, so yep, you can submit the review and comment, and then you could go ahead and approve the resolution and move forward with the referendum. You have up until the day that absentee voting starts, which is 46 days prior to the election, to cancel the election, which is that's why I brought Annandale into the conversation. March 27th was the day that they had up until their May 12th referendum to cancel, and they canceled on March 26th. So they waited, you know, they got the COVID news and tried to figure it all out, and then they just said, you know what, we're out. So March 26th, they rescinded their election altogether. So that pulled back the election and pulled out the review and comment, right? So in this case, I believe that's the end of September-ish. If you were to submit the review and comment, approve the actual resolution to go for an election, you'd have until somewhere in the end of September, I believe. And I can get these dates if they're super important, to pull out and just cancel the election altogether.
Okay.
And then if you do that, the review and comment goes with it. No harm. Yeah. The review and comment, it's awkward that it goes first, because it isn't the legally binding thing that happens. It's the actual resolution that's the legally binding thing. The review and comment is a Department of Education document. So
it doesn't bind us to anything at this point.
No. It binds you in a way that you're describing a project and an amount, right? You're talking about what all the details are. So you can't then go outside of what you've said. So you can't, in a review and comment, say, we're going to build a new building for $45 million and then go build a new building for $50 million. No, you're within the confines of that review and comment for sure. But it isn't, you're not, as terms of voting and things like that, you're not bound to do anything just by submitting a review and comment.
John or Sandy or anybody else have any input?
I was just gonna, so that is for the November or the February you're talking?
The deadline for November for the review and comment is Friday, this Friday.
Okay, that's what I was trying to.
Yep. The deadline for February, the review and comment is right around November 1st.
Okay.
I guess my concern is, or observations, if we've had 20+% people saying need more information, we just go ahead and do this, what's their reaction going to be? They're not giving us the information, so we'll tell them no at the polls. That'll settle that score. So that's my concern about doing this thing by Friday, because that's sending a message out that we really don't need to send you out any more information, public. We're going to do what we want. This is what we're going to do. Amen.
No, because we still have time to go out. I mean, this is just it's a, like Brian said, it's just starting that project. We still have time to go out and educate people. We're going to have a lot of meetings in between.
We're also sending a message that we, at this point, are saying to you people who need more information, yes, I understand what you're saying. We that need more information, you've told us that we're going to do this anyhow by submitting a project by Friday.
I mean, I don't think we're committed to going to the polls by submitting this review and comment. I think we have time to get the information out there.
Jeff, how do you feel?
I'm more concerned about losing those people in the whole project.
How do you feel, Jill?
I'm kind of pulling you guys right now. I definitely, well, I definitely see, you know, the point of waiting until February. But I also see the impact of not getting enough people out to the polls in February. I don't want to rush. There's been a lot made of us rushing this whole process, which really it hasn't been rushed. It has been moving along for quite a while now. I am a little concerned about the review and comment. Let's do it Friday, and then let's quick get this information out to people. I definitely think we can do it. I think February would give us a little more time. I understand that sets everything back a little bit, but I do think that we need to move forward, but we need to make a decision whether it's Friday for the review and comment or November 1st. I guess that's how I see it at this point.
My thoughts are I'd like to see it for February. I think we're rushing it to be done by Friday. I don't know. I think you'd feel a little more comfortable, Ryan, to have your ducks in a row by the February one, wouldn't you?
I'll do whatever it takes, Jeff. No, I mean, no. In reality, again, I think a much more put a bow on it product could be presented in November than it is now. Do I think it's going to be a different product? No. You're going to go out, in my eyes, with the same project, right? The project isn't going to change. It's just the nuances of discussing the inner workings and having everybody understand what it is, right? So I from what I've gathered and what I understand, it isn't as if all of a sudden something completely different is going to happen between now and November. It's just we're going to talk about it. We're going to tie it up and complete it a little bit more. So to that degree, you know, again, can we communicate that through the next few months? Yeah, and have it be okay. But you know, again, I don't like. I understand, you know, John, what you're saying. If people feel like, wait a minute, I didn't even. You gave me a survey, and then all of a sudden this is happening. Well, I get that might be an awkward feeling for people and uneasy feeling. So would November give us a few more months to get that through? Yeah. But again, it's the same. I think it's the same end product, the same, and the review and comments, it's going to be the same, the gist of it, right? So
Ryan, I got a question. If there's a third choice, what would be the next date instead of, you got November, February, what would be the next election date?
April.
April. And that would be paperwork in by when?
I think figure
March?
like the first of the year.
January. So if I mean, this is just throwing something out there, but if we would do the April, at least we'd have more people around in the spring. We wouldn't lose out on the ones in the winter. And it wouldn't be so fast for the first one, if that makes sense. The first one's almost too fast. The second one, we're going to lose out on a big portion of our voters, probably, because they're gone. They go wherever.
They may be gone. They may be.
Yeah.
Right.
Well, they might, but I'm just saying, okay. And then the third one, hopefully everybody, best case scenario would be.
I just devil's advocate here. If you're running into planting, I mean, that's that kind of thing too. You get criticized about those things as well. So I think we need to.
Most planting isn't done in April though.
Well, could be.
I mean, you're just, well, very lightly, but most of it's, yeah. And
I guess.
April. But what I mean, yeah, it could be one of those years where it's an early year or whatever. I was just trying to think of another thing because we were having difficulties with the two of them. I was just thinking of a third scenario.
I guess we're kind of at the point that we need to make a decision. Either a motion needs to be made to go for one or the other, or of the three. I mean, I guess there's really three options. That's what we're looking for, I guess, tonight.
I'll make the motion to go out to April voting.
And maybe just to be clear, if you're not planning on submitting a review and comment for Friday, you don't need any motion at all. Just, but
I would say that's the first thing to decide. If you don't want to go out in November, then let's hold off and let's get some more details before we have the review and comment. I think that's where the question is right now, and I think it's with Ryan also, is that we don't have a firm figure and things that we can use for review and comment at this point. So
we don't have everybody in agreement. So
yes.
John, you were going to say something?
I agree with what Dale is saying, is that we're not ready.
Okay.
We're not ready for Friday, maybe November, but we're not ready for Friday.
Okay.
At least that's how I'm interpreting what Dale said. And
right.
Ryan said as well.
Right. As I think as Dale has said, he wants us all to be together on this too. So if we're not, then it's not right.
I'd agree with that. No, let's do no motion tonight.
Okay. But we'll keep moving. We'll keep working on this. We'll direct Ryan to keep working on this, obviously, because we would like to keep going on this, correct? I mean,
yeah.
As far, we need to keep moving on it.
Ryan, do you think a new timeline will be established and presented to us? Or, I mean, if things have to be adjusted after this conversation tonight, or how will that work? Or
yeah, and literally we're, making sure we're doing what we can to work with the hospital on what they need and how fast they can move. They're a big component in that, right? I can definitely give you the timelines of when things are required. And it seems like the hospital's in a position now. Of course, they've obviously were thrown for a loop in the spring and even through the summer. They've been nothing but positive and saying that this needs they want to keep going with this, and that even February seems like it's okay. We can talk about that, much more committal than November, where they couldn't be committal. So, that's something I think is what I'm getting at, is we need to refine how fast they can move before we know what that timeline is for the district. But all indications that we can get November approvals for February referendum, that seems to be the timeline in which we'd be working on. So yes, we can put a timeline together for you to show what a February election would look like, and see how quickly we can get everybody that's part of this as buy-in to that timeline.
And if we feel more comfortable by October for a review and comment vote, that's okay too, right? We don't have to wait till November.
No, for sure. And that's the very typical, right? Is, you get that out of the way as soon as you can, and then you get the approvals for the resolution and things like that for the election after. So that'd be absolutely, yep.
Okay.
All right, anything else?
I think if the other thing is, just to support what Ryan was saying, is that the hospital needs some more time also. And I think when you look at the survey, the hospital was very important with the people that I think it creates a lot of excitement for the area and some real pluses. So I think that gives some more time to work with the hospital. They need some more time. They've gone through some tough times right now too. So, and they're working with a corporate office that it seems like they need more time every time. But so I think, but don't lose the focus of what that survey is telling you. This is a survey you put together with Sue, and she put out, and I think we don't want to lose that focus. And I think was a real reason for tonight's discussion, is to keep that focus and what it tells us, and go back and think through some more, and let's bring how can we get the information more out to people to listen and to get that information. The other thing is, the time we're going right now, we can't get together for large group gatherings, and so that's a struggle. We're even talking of back to school such things of gatherings, and so that limits us. So so I don't know, that's a decision that I think if we're to move forward with the Friday's deadline, I think you'd have to have everybody on board and everybody ready for that. And what I'm hearing right now, unless you think otherwise, I think we'll move on with, but don't let it go. I think I'll be getting the facilities committee together and working with that too when we can get a chance to get a break here.
So I have a quick question. We all are in agreement though that we do want to move forward with this. So come November, we're going to be on that same page, right?
That's what I'm asking.
And that's what I'm hoping. So yes. Anything else? I think this honestly might be the longest special meeting I've ever presided over. Okay.
Who do we blame for that?
Good discussion, very good discussion. So thank
Yes.
you all very much. But as it is 8:53, I would call for a motion to adjourn.
So move, Boleen.
Motion is made by Boleen,
Second, Sagatol.
seconded by Sagatol. Any discussion or questions about adjourning?
Oh, were we going to do anything with this adoption of the learning? Did we have to do
No,
anything with
Sandy, no. Nope, because that's the advice. Remember, the advisory council has to meet yet.
Oh, gosh, yeah.
Yeah,
Okay. Just
so,
wanted to make
yep,
sure that
yep. Watch
So
your
that would-
email for special meeting, okay?
had
Can
it in
we
my
schedule
file.
that Monday night? Bill?
Yes, but let's let the advisory council meet first tomorrow, and
Okay.
then That
let
will
the
give,
board
we
members,
still have enough time, right, if we decide tomorrow?
yes,
Okay,
let them know, we gotta let them know tomorrow,
yes, yep,
days, so.
okay. I don't want to schedule that without the advisory council meeting.
That would be a very quick meeting, I would assume, on Monday.
Yes,
And my suggestion to Mr. Minton was with that committee is if they could meet tomorrow, go through it all, then maybe have a quick meeting on Monday for them to have questions and a Q&A. This is all new and putting this together. And so the only, I would like to have board approval soon, simply that I think parents
yes.
and community members want to know. And
Yes,
and
yes.
I don't want to make that final decision until the board has acted on it, because it's your decision. And you're responsible for the education of our youth. So that's the reason we want to try and do it, and when that's done. But for right now, that's the in-learning face-to-face is the recommendation coming out of the administrative team.
Okay, we have a motion and a second to adjourn. So if we could roll call vote and finish this up, that would be great. We're going to start with John.
Aye.
Sandy.
Aye.
Melissa.
Aye.
Jamie.
Aye.
Tracy.
Aye.
Jeff.
I don't know.
I myself, I am an aye. So motion carries at 8:56. Thank you all very much for meeting and good discussion, and have a good evening.